Hey guys, it's Dr. E with theManualTherapist.com. So a reader who graduated 3 years ago had an internship with some McKenzie trained clinicians, but he said that they didn't exactly follow the protocol or the system, so to speak, as to how it was instructed at the McKenzie Method courses. He said their visit average was around 12 visits or so. And he was surprised when he finally took the courses to hear the faculty members saying that they get their patients better in 5 visits. And he says he still kind of struggles to get this magic 4 to 6, as I call it, and do I think that's possible using strictly MDT? Well, Adrian, I think that is a very good question. So, um, I, I struggled with this because I actually took McKenzie courses when I was 3 years out, and to hear that these instructors are saying that they can get their patients better within 4 to 6 visits was surprising, and it was also daunting to me, and I didn't really believe it. But when you make it all on the patient and you make them realize that anything you can do for them, whether you put your hands on them or you show them how to do an exercise, is temporary, and it's all on them to really change what they're doing to bring it on, and that if they repeatedly do what alleviates it, that that's where the difference lies. So I find that when when I see McKenzie diplomat practice, or when I see a clinician who's struggling with a patient who refers them to me, the main difference is that the patient wasn't really compliant with their home exercise program. So if the home exercise program is really what makes the difference, one, assuming you chose the right thing to do, then two, what you have to do is make sure that the patient is really following up on that. So I don't actually give patients an option, and it's one of the messages of my eclectic approach and it's a heavily McKenzie-based message, is that there really is no difference between what I do and what you as clinicians or audience or blog readers, um, there's no difference other than my mouth, and I just find that I'm persuasive. So when you don't give patients the option and you make it all on them, then they have to get better. Otherwise, it's really their fault, because when they walk out and they feel better, if they're not able to maintain it, assuming you chose the right thing and you showed them how to do it and they understood, then it is all on them. So what you should really be looking for under the McKenzie method, or really, it's a good rule, whatever system you follow, is that you should really look to make big changes in range of motion and function, or whatever they're in for, but rapid changes should be made within the first 2 visits. If you really only make transient changes that are not maintained and the patient is compliant, it's possible that you didn't choose the right direction, or you need to switch approaches, or you need to use more manual therapy or something as an adjunct. But in terms of using only a strictly MDT approach, I do agree that 80% of patients, according to McKenzie's statistics, do not need manual therapy or hands-on overpressure. And 80%, if you get them moving in the right direction and you get them moving to end ranges, should be better within 4 to 6. So really, the first several visits should be consecutive, and I think that's also a failure. The McKenzie faculty noticed that their outcomes were better in courses than they were in their own practices. And they also noticed that when they further looked at it, that patients who were evaluated on Fridays did not do as well as patients who were evaluated on Mondays. So if the right thing was chosen, or if little tweaks needed to be made here and there, like a little overpressure, or make sure the patient is doing the exercise properly, it was they were much better outcomes when a patient was seen on consecutive days. So when I see a patient on Tuesday and I make a big change, they usually have no problem coming back on Wednesday and sometimes even Thursday. And I think that does solidify and kind of concrete your outcomes to uh, to have a good outcome in the end, because you're able to really kind of hammer home what they have to do and follow up right away. 'Cause if you see someone on a Friday or a Thursday and they don't come in until Monday and Tuesday, and they're not doing their home exercise program as often as they should, and they think, oh, this doesn't work, or they're doing it incorrectly, then you just really wasted several days. So I think the first 2 days after an evaluation, or at least one day minimum, is really important in terms of getting them in next. And I think if you see them consecutive after the evaluation, you will notice a difference in your outcomes. So just be tough, tough love on your patients, be assertive, don't make the home exercise program an option. And if you are, again, if you are doing everything right and the patient's very compliant, then you need to add an adjunct in terms of manual therapy or something else that is going to help them along. So I think if you follow these rules, you'll probably notice that you'll have a decrease in visit average. And if not, we can talk about this further, but I hope this helped. Good luck, Adrian.